All too often, mechanical ventilators are observed to be out of phase with the patients to whom they are interfaced. This is a worrisome event when observed clinically, and a dysfunction that can impose an enormous workload on the patient. This presentation explores the physiology and respiratory mechanics pertaining to asynchrony and discusses several strategies which can be implemented to counteract it when it is encountered in actual clinical practice. The presentation begins with a definition of asynchrony and describes anatomic sites that can be selected to detect and quantify patients' asynchronous efforts. It is, of course, possible to employ sensitive, high-tech instruments to portray the presence and extent of asynchronous efforts, but practitioners can detect this dysfunction quite easily at the bedside by means of the fundamental techniques of inspection and palpation. Certain populations of patients are vulnerable to asynchrony, and the module describes in detail why the presence of an elevated level of expiratory flow resistance is likely to result in asynchrony. Because so-called auto-PEEP is commonly associated with asynchrony, that disorder is examined closely, and the mechanism of interaction between auto-PEEP and asynchrony is clarified in order to enhance caregivers' understanding of the respiratory mechanical basis of the two conditions. To the extent that clinicians observe asynchrony in patients to whom they are assigned, it is important that they be aware of steps that can be taken to alleviate it. One simple method that requires no electronic sensors or equipment whatsoever is described, together with a second methodology, NAVA, that is offered as a feature on a particular brand and model of mechanical ventilator. The neurorespiratory physiology upon which NAVA is based is then explained, and the advisability of combining NAVA with the imposition of external PEEP is discussed. If there's another source of the information that's embedded in this module available to RCPs, we don't know where it might be. Therapists who provide direct patient care to mechanically ventilated patients are well advised to acquire a thorough knowledge of ventilator asynchrony due to its high incidence and because of the enormous energy deficit which it imposes upon those patients who present with it.